Before that, let's understand the types of hypovolemic shock. In this, you have to remember the percentage of blood volume loss, which is you have to do the table of 15. So in one, that is less than 15%. In two, you have to multiply by 2. 15 to 2 is 30, so 15 into 15 to 30. And in class 3, 15 3s are 45, it is 40, just remember that. So 30 to 40. And in class 4, it is more than 40%. Okay. In class 1, everything is normal. Urine output and everything, every parameter is normal. So class 2 is what is compensated phase. Class 2 is what is compensated class of the hypovolemic shock, where the body senses the loss of blood volume. So parareceptor senses low blood pressure, that activates the sympathetic system of the body, and that leads to increase in the heart rate and increase total peripheral resistance to maintain the blood pressure. Parareceptors is the earliest mechanism the body has to maintain the blood pressure. Okay, so if there is increased TPR, as diastolic blood pressure is the direct measure of TPR, so that increases. So initially, what is the changes? What is the initial parameter changes? Is there is increased heart rate and there is increased diastolic blood pressure. So as pulse pressure is the difference between systolic and diastolic blood pressure, and as diastolic blood pressure increases, there will be decreased pulse pressure. Okay, rest everything remains normal. This is class 2. So T here, so patient is from T, it is thirsty or anxious. In class 3, now it is decompensated phase. Okay, and here heart rate increases further, but the body is not able to compensate for the loss of blood volume, so the cardiac output finally decreases in this. And as cardiac output decreases, there will be effect on SBP. So SBP also decreases because SBP is the direct measure of cardiac output. So if that decreases, SBP decreases, and DP was increased, so now pulse pressure further falls because now SBP also decreases and the difference the narrows further. Then respiratory rate finally increases. Why? Because there is less cardiac output, that means less oxygen supply to the tissues. So now there is anaerobic glycolysis in the cell, accumulation of the lactic acidosis that leads to metabolic acidosis. So to compensate for the acidosis in the body, the body has to do respiratory alkalosis. So it increases the respiratory rate to throw out more carbon dioxide from the body. Okay, so that is the compensation. So your respiratory rate increases, and because of the less cardiac output, there is less blood supply, less renal blood flow, so that leads to decreased urine output. And here in class 3, the person is in confused state. C is the third letter, so in class 3 the person is confused. Don't confuse it with coma, because coma is obviously the part of the last class. So in class 4, everything is non-recordable, there is no urine output, and the person finally goes into coma.